HR Unlocked, the podcast. We're your host, Abby.
I'm AJ. Yep. Mm-hmm.
So welcome back. How you doing, AJ?
Hold on 1 second.
Oh, okay.
So you've been gone a long time.
Perhaps.
I mean, I know you got married and stuff, but
I did.
my God.
Sorry.
I mean, if
So sorry.
yeah, sure. Happy
I'm
New
back.
Year.
Happy New Year.
How long should we say that? Happy New Year.
Ooh, I think at least a month, right?
Okay.
A month.
Okay.
Sounds right.
I mean,
So, welcome. We have a very special guest today. His name is Curtis Cannon. He is with us today through the whole episode, right? The entire time. But thank you so much for being here with us today. Curtis owns his own employee health consulting firm.
Yes.
So which is really, really exciting, especially in these days and times. I think what you do is really, really necessary work. Curtis is also partnered with local governments, educational institutions, right? And large companies
That's
locally.
Right.
So welcome.
Thank you.
Outside of that, I know some of your topics of engagement are stress, burnout, depression.
Yeah.
Does that kind of?
Yeah. Well, the main thing for us is that we want to bring healthcare to the workplace because we understand that it's challenging for some employees to get to the doctor, to get to the help they need. So we want to make it convenient and easy for people.
Yeah.
and Curtis, I know you also advocate for mental health, and
Yes.
Abby and I were just talking about how important mental health is for HR.
Yes.
Who really thinks about it? Like, we take on all of that stress, right?
Right.
And the burden of the employee and their problems and the company.
Yeah.
Like, is anybody looking out for us? Who is HR to HR? I think we've said it a
Right.
couple times.
HR for
Yeah.
HR.
Right. Who's supporting the people that's supporting the people?
That's right.
Right. So I think it's important that they have the tools and resources they need. So that's why we bring in the therapists to come in, the counselors, so they can come in and teach stress management techniques, things that can help even HR, especially HR, because you're dealing with people and people bring problems. Unfortunately, that's how it works. Right.
He brings problems.
And, I know
She's been gone.
it's going to be a problem for you in a minute. But,
oh my God.
It really is one of those things where we feel confident that what we bring to the table can help the employee base as a whole.
Yeah.
So we're excited about it.
Yeah. Yeah. That's good. So before we get started, so Curtis, we have fun here. Okay. We have a lot of fun. We joke and we play. We also talk about serious stuff. And we got a serious thing we got to talk about today. However, it's 2025. What is one thing you're annoyed with already? So let me go first. Let me go first because I'm sick of Androids. Okay, these green bubbles when you're in a group text,
And you don't know if they got it. You'll know if they got the message.
and then add all these numbers, and then boom, it says text message. I'm like, who is that?
Right.
Who has the Android?
How rude.
Get an iPhone already. I mean, you gotta get with the program.
Right.
But I
right.
just had to say that because it's just been eating me alive.
Right.
Because recently,
They're expensive now. They're like what a whole car used to cost. Really?
really,
What, $2,000, $3,000
I mean,
for the newest iPhone?
you have iPhone.
Come on. Yes,
Yeah.
I
Okay,
do.
okay.
Not the newest one, but I do.
Well,
Right.
get with the program, Abby. I mean, I know you've been gone a while.
I know. I guess I'm back. I'm back in 2024, right?
Welcome back. Welcome back.
So how about you, Abby? What's something that's annoyed you so far in 2025?
TikTok. I'm done with it. I'm done with TikTok. Here's why. I think people will post reels or I guess TikToks of things that aren't meant to be on there. I'm sorry. It's too personal. They're making jokes out of things that shouldn't be made a joke. So I think that the ban will be good for America.
So I'm concerned. What are your algorithms or what's going on? What are you searching over there?
I don't know. Some things are just strange, They just come in. So
Yeah.
it's nothing to do with what I like.
Okay. Yeah, we'll stick with that. Welcome back, Abby.
Thank you.
Curtis, what about you?
Well, starting out for 25, just the thought of taking down all those Christmas decorations. Let's just start there.
Yeah.
Absolutely.
Because I'm the kind of guy that it's a chance it could stay up to March. If nobody
now, Curtis,
taps me on the shoulder, that's going to be a problem.
Okay.
Yeah.
Thanks for coming, Curtis. We really appreciate your support. March.
Right? Well, you get in there, you get excited in November, December, then, all the disappointment of having to take it down, it's all over.
Yeah.
Everybody's opened their gifts and, it's all over. So it's time to start real life.
Well, I only put a wreath on the door, so that's easy, right? I just take it on down. I took it down December 26th.
Are you the Grinch?
Okay. That's almost like a funeral.
Yeah, I'm like
I put up a wreath for the lost.
a Christmas tree.
I feel attacked. So I need to report you guys to HR. Okay.
Oh,
Yeah.
So Curtis, I know we talked before we started recording. And you're in the mental health space. You've had experience with benefits and employee benefits and things that we tackle on a day-to-day basis, right?
right.
But something interesting happened, and really unfortunate.
Yeah.
We had a CEO that was gunned down.
Yeah.
United Healthcare, I think, and the outrage was very different from
Yeah.
normal,
Very different.
in my opinion. It was more of a celebration almost.
You're right.
So there's two things I want to tackle. Your thoughts on the employee benefit side and, of course, how you feel about that.
Yeah.
Because you have direct experience.
Yeah.
But also from an HR perspective, what are we doing? Like, how do we respond? What is the statements we should send out? Those things, and Evan and I were talking about it, is poor us, to a certain extent of, all right, so from a people perspective, what do we say to the people?
Yeah.
Right.
So first, let's go to the CEO and employee benefits. Tell us a little bit about your experience with, I think, Blue Cross, right?
Right. I was there for 12 years. I dealt directly with the employers, so I dealt with HR professionals. I'd be the guy kind of talking through the renewals, those unpleasant conversations about rate increases.
Yeah, we just love you.
No,
when you
right?
come
You
in.
guys just love to see me coming. But, I did that for 12 years, and then I was a broker for another 2.5, 3 years until I started my own firm. So I think the conversation really needs to be geared around, how do we fix the system? And I think the visceral response from the public has been alarming. The celebration of a man's murder, right? Let's call it what it is. The guy said at his own bean count, this guy Luigi, if I get his name right, he said at his own bean counting conference. So it really reveals or illustrates the kind of disdain I think a lot of Americans have for the insurance industry. But they are now, what I feel, the industry in itself is being characterized by some of the leadership. And so when now, you have the risk of other CEOs and other executives having to beef up their security.
Absolutely.
They're very concerned. So I think having to monitor and measure that conversation, have really, transparent talks with your employees are going to be critical. So that you don't bring that type of energy to the workplace.
Right.
Absolutely. And I think just like with any organization, I know that they targeted the CEO, but he's not the sole decision maker.
Correct. Correct.
So there is a legion of people beneath
right.
him
That's
that are making decisions as well. So
That's right.
although people were celebrating this quote unquote win, which is to me,
It's bizarre.
yes, very, very bizarre. Who's really winning? Because there's so many other decision makers and people that are a part of these processes that people are upset about. And I understand it because, with healthcare, I think things need to be revamped a little bit
Right.
in order to get people the care that they need, but also people need to understand how they can access and tap into healthcare and have it work for them, right? Because so many people, working, within my company, you have people who are signed up for our healthcare plan. They don't even utilize it. They don't even understand all that it can offer them.
Right. And when they use it, when they finally get around to using it and they really need it, it didn't work for them.
Yeah.
Right.
They don't understand that they may have a $2,000 or $3,000 deductible, and not to mention I'm paying a lot in my premium. It's coming out of my check. So why am I having to pay this huge deductible? Not understanding how it works, and so there's, and rightly so, there is some real concerns and anger of everyday Americans on how the system is structured.
Yeah.
I always say that, things like primary care, and that's why we focus on things like bringing worksite clinics and primary care to the workplace, because things like primary care are not high dollar, cost items in healthcare. I liken it into like getting an oil change or tune up on your car. If you keep the car healthy and running,
Absolutely.
you can get away from any type of engine trouble, transmission trouble, which is the more expensive, more concerning matters. So again, that's getting more into the focus of what we do. But to your point, I think it's important to make it clear that we really have to put new regulations in place, new things that are going to change the system. Some people are advocating for, government sponsored care. I don't know how that works, but I will say there needs to be a certain change for sure.
Absolutely.
You know, you brought up a good point of sometimes we don't know we have this $2,000 and $3,000 deductible.
Right.
As I think about my career and how at one point I was over benefits and leave of absence, and did I really understand every aspect of the benefit plan?
Right.
Could I confidently explain it to someone who had no idea? Probably in the moment, of course. I can
rattle it off.
tell you exactly. I
Right.
can look at these talking points and know exactly what.
Yeah.
But if they ask me a very more personal question, like if I had a surgery today,
Mm-hmm.
how much would it cover?
Right. And that's not
Could
a
I-
clear.
Could I
Clear
tell
answer.
them? Absolutely not.
Right.
Should I know? Maybe.
Right.
Because we as HR professionals, they come to us because we have the answers,
Yeah.
or we should, or they think
Yeah.
we have
We have
all
the
the.
You're
resources,
perceived
at
Yeah,
least,
to
to
have
be
the
able
Yeah,
answer.
to-
exactly. Could I say, oh, well, reach out to Blue Cross?
Yeah.
But is that really the resource that you're coming to, right?
Right.
I hated doing that.
Right.
And I try my best to learn as much as I could. And Abby could attest to this. I try my best to learn everything I could. So I wouldn't have to reach out to anybody.
Yeah.
I could tell you the answer,
Right.
or I could find it and come back to you and tell you.
Right.
But as HR professionals, and Abby, you tell me, I know benefits are your big thing. Are we really equipped to handle those type of conversations? Or do we need more training or more like information? Maybe we should be included in those benefit
Negotiation
and
things like that.
conversations.
Yeah.
It's a great point.
Yeah, I think the biggest thing is education. You said that. I think it's so important to understand what your benefit plan is, and not just on the baseline levels, right? Because at the end of the day, like you said, we can ramble off what your deductible is going to be,
we can
what your
read it.
premium is going to be, but truly ensuring that the employees understand what they're paying for. I think that is the key in ensuring that they utilize it.
Yeah.
Because like in my company, we do a yearly health clinic that comes on site, and they get the preventative, checks,
Yep.
right? They draw blood, they do the whole nine. And that's completely free. Thankfully, we do it on site, but I've worked at other organizations that don't have on site, health screenings that they do yearly. So employees just don't go.
Yeah.
Also incentivizing that a little bit. Not saying we're going to give you money, but just being like,
Right.
hey, come down. Like, we have snacks. Like, you get, to take your extra 30 minutes. Like, let's watch this video on why health is important. I think especially in the Black community, because there's huge health disparities that exist, right?
Yeah.
So, like I said, education has to start there.
Yeah.
And as HR, we have so much under our belt, right? I know you said you were leave, you were managing leave, but you were also managing employee engagement, employee relations. Like, we were all over the board. So
Trying
I
to be
think,
subtle.
right. So I think it's important that we bring in the specialists.
Yeah.
We have these open hours for benefit talk. So that maybe a representative from Blue Cross Blue Shield can come out and answer those questions in depth. Maybe it's once a quarter, maybe it's twice a year. I'm not sure the cadence or how it would work depending on the organization, but yes, we need to know our own benefit package, but we also need to understand that there's going to be a line where the specialists have to help us.
Yeah.
Right.
They have to
That's
be there
right.
as a support element to
That's right.
speak to the things that we don't know as in depth.
And Curtis, with your experience at Blue Cross, would you be the person that comes out, or
Yeah, well, back then, they use a lot of the account managers to come out. They'd come out and educate. What I recommend a lot of companies do is some use the term benefit cafes. So essentially, they would have benefit meetings every quarterly on a quarterly basis. So the employee's first time of hearing about benefits is not just open enrollment. You have a tight window of time to learn a lot of information.
Yes.
And again, insurance is kind of like a spare tire. You don't know you need it till you need it, and when you need it, you need to know how it works.
Yeah,
right.
absolutely.
So I think and kind of going back to what you said, AJ. I think what's important is that companies look at where do they get their support and how do they get the help they need from new and innovative resources. So I'll give an example. I support a company now because of my experience, because of my background in a consulting role. I help them kind of build out their benefits team. So what I want them to have are people that are very knowledgeable in benefit administration and people that have worked
Yeah.
in the carrier space, right? And these are the people that can give you the secret answers, such as, I'll release one now. that, if you have a routine screening done and it's rejected for any reason, one of the things you can do is ask, if you're calling customer service inquiring about that rejected claim, is ask about a secondary diagnosis. Because in many cases, that routine screening diagnosis has a diagnosis, may have a secondary diagnosis, so they can process that claim on the secondary diagnosis. Now, they're not going to tell you that. You're going to pay for that rejected claim, more than likely. But if you know that information, see, that's the kind of thing that makes a difference when you have a conversation with your team.
Absolutely.
And they say, wow, that was so good to know, because I had a claim deny, I had a screening deny, and like, for example, low deficiency, vitamin D, low vitamin D can be a secondary diagnosis, and those for vitamin 12 or B12 shots. So there's certain things that'll deny automatically, but if there's a diagnosis on the second level, they can process it. I mean, there are so many little tricks like that you need to know.
That's a good. Wow, that's good, because how about, I think I researched, probably preparing for this, appeals.
Yeah.
Can I know we can appeal it, but what does that look like?
Yeah.
I mean, we call them, hey,
Well,
I need to appeal my claim. Who do you call? Who do you call? What do you say?
You don't feel empowered.
Right. It's kind of like,
Asking questions.
it's kind of like, oh, can I appeal? I don't know.
Yeah.
Well, I mean, and just to piggyback off of what you said, my mom, she had to have cataract surgery. Initially, the insurance denied it, and they said that it's not medically necessary, which was wild, because the doctor said, hey, listen, if you continue to have this, you would eventually lose your vision.
Right.
So it was scary, because I'm like, all right, Mom, then we're going to have to pay out of pocket.
Yeah.
But her doctor sprang forward and said, no, I'm going to do a peer-to-peer.
Yep.
And I'm going to petition on your behalf and let them know, like, hey, this will be degenerative. It'll cause her to lose her sight. It took some time. Unfortunately, it honestly took about 3 to 4 months.
Yeah.
But after that, she was able to have it approved and have the surgery on both of her eyes, and everything went well. But what it echoes in me is how unfortunate that she had to wait that time.
Right. And I think what people don't understand is that so many outpatient procedures now require pre-approval, right? So now they're trying to, I would assume, mitigate some of this delay by having those prior approvals. However, there are times where your doctor has to submit additional information, documentation, some X-rays, imaging that can support the need to have the procedure. So my whole thing is,
Carter, you said support.
Yeah.
But it's really proving, right? It's proving that it's medically necessary.
Right. Right. Oh, and that's a term. I mean, when I tell you that is the number one used term in insurance and medically necessary, and a lot of it is you have to understand how the healthcare system works, and there's money. They make money off premium. They lose money on paying claims.
Yeah.
So you do the math.
Yeah.
And so many Americans are just saying the math ain't mathing.
Right.
Absolutely.
I'm paying a lot in premium.
I'll be math.
But I'm not getting
I'm not getting the return.
Yeah.
Absolutely.
Paying the deductible out, and I'm having to pay for the entire service, or I'm getting this rejected claim, or I'm getting all of this. Hey, I need more documentation to substantiate this procedure.
Yeah.
So anyway, it's
And what's worrisome is during that time, that waiting period. Thankfully, with my mother, it was okay. But for somebody who may have a greater ailment, it could be, maybe it could be life or death. I don't know.
I mean, you start thinking about
scary.
cancer and how it continues to progress, and you're waiting on the decision,
Right.
right? And nobody wants to be in a holding pattern when they're dealing with that, an aggressive form of cancer. So again, this goes back to the earlier point of what got Brian Thompson, unfortunately, that CEO for United, got him jammed up, is these type of things that are enraging Americans.
Absolutely.
And Abby, you said something. He's not the sole decision maker.
Right.
Sure. Probably not. I mean, we have people, right? As you know, we have companies and people that bring us data, and we have advisors and senior leadership that helps us. And, we've been in those rooms where this is what we need to do. And the CEO could say, okay, sounds right to me.
Yeah.
You're a senior VP or executive or whatever. But he's like the face of the organization, right? It's his fault from the
Yeah.
from the public eye,
Yeah.
just like us.
Yeah.
If something goes wrong, it's HR's fault.
Right.
Yeah.
And it's crazy. It's crazy how we get blamed for these things, but it's kind of, we've never been gunned down or anything, thank God. But it's like he's the face of the problem.
For sure.
So as we see here today, how do we, if it's possible, I know one solution is we're talking about it. People can reach out to Curtis, right? His company, right?
They can.
Go ahead, tell
I'll,
us.
I'll talk a bit about that. I've gotten out of the insurance space because of the very reason that we're talking about here today.
Yeah.
I wanted to be on the preventive side of things. So that's why we bring the doctors and the counselors and the therapists to the site to educate people in areas that they lack education about their mental health, about some of the chronic issues that they are dealing with. Like you said, the screenings. We have some screening events where we come out and have nurses come do biometric screenings when people are on the verge of needing to be admitted to the hospital, and they're not knowing they're on the verge of a stroke because
Like
of
at
their
work or
at work.
what-
They have their vision is blurry.
Yeah.
Things are happening to them. You think about in a manufacturing environment where guys are working 12 hours, round shifts.
That's what
They don't get a chance to go to the doctor very much.
Right.
They're having to work and put food on the table and just sleep and come back the next day.
And sometimes, man, we don't want to.
Yeah, we just, it's hard enough to get us to go to the doctor.
How long? It's not. Don't say it like this. It's true.
It is.
Right. Yeah, you guys are. I won't say the rest, but you're right. I think I wanted to get out of that. So, but I also still enjoy informing people about what I shared earlier about, the proper thing to do if you need to get more out of your health plan.
Yeah.
And to your earlier point where you said you guys get blamed for everything, you think about open enrollment, you guys are kind of selling the insurance product.
Yeah.
So when it doesn't work, who do they come and blame?
Yeah, it comes right back to us.
Yeah.
Unfortunately.
Well, you told me.
Yeah.
I could do this.
You said this was the best plan.
right.
Yeah.
I gotta,
Did I? Did I really say that?
right.
Or
They
did I-
always hear something
Or
different.
did I advise that we have 3 different plans?
Right.
This
Right.
This is my plan.
Right.
Yes.
right.
You
That's
know,
the other thing.
And
Right.
I gave you pros and cons of all plans. Did I say it was the best plan?
That's right.
We're strategic in our words, so we didn't say that,
yeah.
but we might have said
Sometimes when someone is, upset or disappointed, they're
Yeah.
going to say,
you the one,
Sure.
or the ones if we help them with their benefits, like do enrollment.
Mm-hmm.
Oh, you did it. You the one. I didn't click that.
You put me in that plan.
Yeah, I didn't do. I did not do that.
Right.
Yeah.
Right.
But I think bringing it back to what you were saying, how do we navigate those conversations?
Mm-hmm.
How do we make things better as a whole, especially on the HR side? I think to me is engage. Get people to understand what the benefits of having insurance
Yeah.
and not just insurance, all the programs that are offered in open enrollment, right?
Yeah.
Because health insurance is just one aspect of
That's
it.
right.
Yep.
That's right.
So for me, I think that's super, super important. Engage, educate, because that's the only way that we're going to drive change,
Yeah.
right?
Yeah.
And then I think when people are fully educated, then they can make the proper decision for themselves.
Yeah, and also say this: there are companies out there that serve as advocates for your employees. So they're not paid by the insurance company; they're paid directly by the employers, but they're not the brokers necessarily. I'm talking about there's certain companies, I won't name them because I don't want to give them free advertising, but essentially what they
See
do
your
is they
check.
investigate claims that are denied.
Yeah.
So they'll help you get your stuff approved.
Yeah.
Pre-admission certifications, they'll kind of handle that for you and help you navigate and ask the questions. So they'll investigate things that need to be investigated for you. So again, you need these kind of strategic partners to help you guys look good in front of the employees.
That's
right.
Yeah.
That's
Yeah.
That's good. I didn't know there were people out there that. Well, it seems like Curtis is the man with the plan here. Curtis, we appreciate you so much for stopping in and talking with us today. I think we're gonna definitely have you back because the next topic or the next conversation I want to hone on in is mental health.
Yeah.
Like
Yeah.
just mental health from let's just broaden out a leadership perspective.
Yeah.
Because leaders, we are often got so much in our hands, and we got to deal with so many decisions.
Right. Right.
Sometimes we need a break,
Right.
but it's like, can we take a break?
Right.
Can we really take a PTO?
Right.
can we disconnect?
Right.
So I think
Is that such a thing as disconnected?
is
these days
it?
with
Right.
the phones
Hello,
and
hello out there.
laptops?
Yeah.
Right, exactly.
Yeah.
Like, can we turn the notification off? Can we uninstall the app or whatever we got to
Yeah.
do? Can we really do that? Can we put our phone on do not disturb?
Yeah.
Don't notify anyway.
Yeah.
Do not, yeah.
Yeah.
So it's like, can we really do that? But I think if we can't, what is our outlet? How can we focus on? Okay, we can't necessarily disconnect, but can we talk to somebody about
Yeah.
anything we want to talk about
Right.
to help us navigate that? Okay, I need
The workplace stress, the life stress. I think the problem that we have to really look at is some of the toxic behavior that we see in the workplace could be a result of things happening in people's personal lives.
That's right.
So you wonder why
right.
Jeff or why Mary or whoever is always negative or
Brenda.
always, real, snappy.
Yeah.
They may be going through a divorce. That's
right.
They may be going in highly stressful situations that
right.
we have no knowledge of. We just try to avoid that person instead of really seeking to help them. And so and I hate to go back to this, but I'll continue to say it, that bringing this type of care model, lunch and learns, things where people can learn while they're in the workplace.
Yep.
And that's the kind of stuff we do, where they're in a non-threatening environment and they're learning, and they're not necessarily having to expose where they are mentally.
Got it.
So we can say, hey, listen, let's talk through stress today. Let's talk through depression. Let's talk through these areas. And it never fails. After the session, there's always a 2 or 3 people hanging back wanting to get an appointment with the therapist.
Right.
And we always use therapists that are in network with the EAP. So if there's a client that we have and they have EAP with behavioral health or whoever, we make sure that they're in that network. So when they have the one-on-one, they can get the help they need right then.
And it's
in
free of
private.
charge to them, typically in
Absolutely.
most CAP.
And that needs to be talked about more too.
Yeah.
For sure.
Yeah.
That's the most
Utilizing
under-
that to the max. We
Absolutely.
promoted that early on in our career.
Oh gosh.
We've promoted EAP, but a lot of places they don't. And it's really great services that are free of charge that can really help people through difficult times.
Absolutely. It's really the problem of people thinking that their information is going to be revealed to the employer. That's why they say, I won't call the EAP because I don't want my information revealed. But they have a responsibility through HIPAA and all of that not to exchange that information.
Yeah.
Absolutely.
Your company only gets aggregate data, like 14 people came and used the service today. No
Right.
names, no nothing.
Yeah.
So I think that needs to be messaged more intently. So
Right.
Yeah.
Confidentiality. For sure. Yeah.
absolutely.
Man. So on that note, we need Curtis back.
Absolutely.
So hopefully you don't get married to anybody else. Have any more vacations or go missing.
I can't make any promises.
No, if you do,
Now it's time to start a family.
right? Exactly. If you do, Abby, I'll just bring Curtis in as your special.
Temporarily.
No.
Temporarily.
Well, we'll see. But Curtis, thank you so much.
Thank you guys for having
Abby. Welcome back. Thank you so much for coming, Abby. Thank you. Curtis, it was a pleasure. It was a pleasure having you.
Likewise. Thank you.
We had a really good conversation.
That's a lot of fun.
Yeah, I
It
can't wait.
was.
I can't wait to have you get back to talk more.
Yeah.
Sure.
Be a lot of
Abby,
fun.
do you have anything else?
No, thank you so much. Your insights are great. I think that we have some really good information for the people. That's what we want. So
Yeah. Well,
Until next time.
let's have a great week.
great week.